Welcome to the Demonstrating Implementation Excellence stream of the SNOMED CT Expo 2024. Thank you to FAST for sponsoring the stream. My name is Kai Keeley. I am an implementation support technical specialist at SNOMED International. I will be moderating today's session. All questions will be answered at the conclusion of the presentation, and I encourage online attendees to please use the Q&A button to type your questions to the presenter. I'm now pleased to introduce Linda Parisien from Canada Health Infoway, and also Jacqueline Singer, who's joining us online from the Canadian Institute for Health and Information. And they will be presenting Canada's journey towards connected care, a collaborating to create the foundation for semantic interoperability. Great title. Linda, please go ahead.
Thank you so much. You can hear me? Okay. Good. So yes, I'm in person and Jacqueline is online at this moment. And as we go through the presentation, we're going to see her talking at some point. So presentation outline, we're going to be discussing about the challenge, the journey for connected care in Canada, and I will end with a use case for which I've worked on since many years now, immunization. So we're really pleased to present today on a successful collaboration project that is towards a journey for sharing proper information between different actors in Canada, stakeholders, organization, to enhance the health information systems and have the ability that we hope will get the ability to work together going forward. So this is only feasible through implementation of standards and specification, and that is what we're going to be presenting today. So Canada Health Infoway, who are we? So we have the objective of having healthier Canadians through innovation and digital health solutions. Canada Health Infoway works with the government's healthcare organization, clinicians, patients to make healthcare more digital, ensuring that everyone is capable and able to access health information and services that are in most cases online now these days. We're an independent, not-for-profit organization founded by the federal government, and our mission is to bring pan-Canadian focus to improving the patient experience, improving health of population, and unlocking the value for the health systems. The CIHI, Canadian Institute for Health Information, has an objective for better data, better decisions, and again, as with an outcome of a healthier Canadian. They are an independent, not-for-profit organization that provides essential information on Canada's health systems and the health of people that are living in Canada. They work closely with the federal, provincial, territorial partners, as well as other stakeholders in the Canadian space to gather, package, disseminate information to inform policy, management, care, and research, leading to better and more equitable health outcomes for all Canadians. Their mandate is to deliver comparable and actionable actions to accelerate improvements in healthcare, health system, performance, and population health across the continuum of care. So I'll turn over to Jacqueline now for the next portion of the presentation.
I'll start by sharing some background and context on both the challenge and opportunity for Canada in achieving connected care. Before we begin, I think it's important to remember why we're doing this work, and that is ultimately to improve healthcare for Canadians. And while I'm speaking about our experience in Canada, many of these challenges likely resonate in other countries as well. Currently, in Canada, most healthcare data is not standardized or shared systematically across digital health systems, and this leads to significant problems, including patient harm and even death. One such example in Canada of the potential for harm due to lack of interoperability is the story of Greg Price, who tragically lost his life at the age of 31 as a result of delayed diagnosis and treatment related to testicular cancer, Greg went 400 days without receiving an accurate diagnosis, despite numerous interactions with the healthcare system. Greg's death led to inquiry, which ultimately found that he died as a result of a fragmented healthcare system where the right individuals did not have the right information at the right time in order to provide Greg with quality care. This fragmentation leads to many other issues as well, including placing unnecessary administrative burden on healthcare providers and duplicate tests, which can lead to wasted resources. A truly connected healthcare system can help with all of these things and ultimately improve patient care. At the end of the day, that's really why we're doing this, to improve patient care and to help ensure that no other family has to go through what the Price family went through. There is a call to action within Canada to advance interoperability. In 2022, a series of reports were released outlining a pan-Canadian health data strategy. This work set the stage for a new era of collaboration under the Working Together to Improve Healthcare for Canadians plan, in which Canada's federal government provided targeted bilateral funding to provinces and territories for 4 shared health priorities, including modernizing the health system with standardized health data and digital tools. In May of 2023, Canada Health Infoway released the Shared Pan-Canadian Interoperability Roadmap, which serves as a blueprint to achieve seamless and secure data exchange across the healthcare system. In October 2023, the federal government announced the Pan-Canadian Health Data Charter, which requires, among many things, common standards for terminology and interoperability. Later that same month, a landmark report called Interoperability Saves Lives was published, which reiterated the need for a patient-centered health system approach for better patient care and improved health outcomes. Finally, in June 2024, Canada's federal government announced Bill C-72, which outlines Canada's plan to enable a modern connected care system in which health information is securely accessed by patients and shared between care providers when needed. Canada has made significant progress in the last few years towards a connected healthcare system. There's a lot of momentum and opportunity as we move along with our journey towards creating the foundation for semantic interoperability. Responding to the call to action, CIHI and Canada Health Infoway are working together to modernize health information flows to create a connected health system. Both our organizations have pivotal roles to play in enabling connected care and as outlined in the Shared Pan-Canadian Interoperability Roadmap. The overall strategic goals of the Shared Pan-Canadian Interoperability Roadmap are to reduce data blocking and facilitate portability, improve provider access to patient data at point of care, enable patient access to their health record, and improve care coordination and collaboration. These strategic goals will be achieved through key building blocks, which are shown in the red circle. The first building block of the Shared Pan-Canadian Interoperability Roadmap is a strong health data content foundation. This is where CIHI comes in. You can think of this like CIHI is building the what? One common data content standard and data architecture for all health-related data in Canada. Infoway is building the how, the technical exchange standards that enable information to flow between systems, and also leading many initiatives related to the other building blocks. Both our organizations are making sure to keep the patient at the center of this work, ensuring that all of the work that we do is ultimately patient-centered and that it leads to improved patient care across the health system. One of the key products needed to enable connected care are common data standards. This is where the Pan-Canadian Health Data Content Framework comes in. The Pan-Canadian Health Data Content Framework is one common data content standard, data architecture, and business glossary for all health-related data in Canada. I like to think of it as a strong foundation to enable the capture and exchange of high-quality healthcare data. You can think of it as the source of truth that will define the foundational data for healthcare delivery and management across all healthcare sectors. It's really the strong data foundation that ensures meaningful exchange and interpretation of data across the healthcare system. This is ultimately what leads to semantic interoperability, where the data has the same meaning for the sender and the recipient. One thing that makes the framework unique is that it provides one data content standard and architecture for all health-related data, for both primary and secondary uses. The scope of the Pan-Canadian Health Data content is quite broad. You can think of it as a super standard that will represent person health, care organizations, health system planning, and population health. In the past, CIHI focused on health system management, which has traditionally been our area of expertise. With the Pan-Canadian Health Data Content Framework, however, we're ensuring that we develop data standards that meet a wider range of information needs, from person health and clinical care to care organization operations, things like quality improvement and program planning, to health system management and population and public health. Much more comprehensive approach than we've taken in the past. The Pan-Canadian Health Data Content Framework itself is a series of deliverables. It includes a data content standard as well as a subset of data categories and data elements called the Canadian Core Data for Interoperability, or CIHI. Both the data content standard and the CIHI define concepts and themes like immunizations and health concerns, data elements, for example, immunization date, immunization reason, and also include value set recommendations. The framework also includes a common data architecture, including a business glossary, use cases, and a series of models, which highlight the relationships between the various concepts included in the framework. We're also releasing a feedback disposition document, where we summarize and respond to the comments received from the last round of open review. This is an important component of the spirit of open and transparent standards development. To enable connected care, we have to start with the data content standard, but an equally important part are the exchange standards. You can think of the Pan-Canadian Health Data Content Framework as the what. So it outlines a comprehensive set of health information that should be collected and shared in a standardized way across the health system to satisfy a variety of health information needs. The CIHI is the essential. It's a subset of the framework that outlines the essential data needed to support Pan-Canadian interoperability. Has a very specific focus. It's the core of the core. And the CI Core Plus, developed by Canada Health Infoway, is the how. These are the technical exchange specifications, or FHIR profiles, that outline exactly how the CIHI will be exchanged between systems. Together, the CIHI and CI Core Plus work in tandem to facilitate interoperability and data exchange and to allow standardized data to flow between different digital health systems. We know that we can't do this alone. Interoperability is a team sport and requires collaboration from stakeholders from across the healthcare system. We've worked closely with different groups of stakeholders, including Indigenous peoples, persons with lived experience, care providers, provincial, territorial, and federal governments, researchers, hospitals, and health authorities, and industry partners. If we're going to achieve true interoperability across the healthcare system, we need to ensure that all of these groups have a seat at the table. CIHI and Infoway are very committed to this. Based on input from these various stakeholder groups, we iterate the content to ensure it reflects clinical and administrative realities while maintaining alignment between the data content standard and supporting architecture. Each component is released with a maturity rating, indicating its readiness for use. The first version, recently released a few weeks ago and now available for open review, is a draft for reference and not yet intended for implementation, while we continue to iterate the content. Throughout the development of the Pan-Canadian Health Data Content Framework, we are leveraging lessons learned from other countries who are further along in their digital health journey. We intend to align with other international standards where possible, such as the International Patient Summary, and learn from other countries' core data for interoperability, or CDIs, such as from the US and Australia. We reference many other health data standards beyond those listed here. For the full list, please refer to the business context model, which can be accessed through CIHI's Connected Care product page, and a link is provided in the reference slide at the end of this presentation. At a high level, we developed core principles to guide our terminology approach for the Pan-Canadian Health Data Content Framework. The value sets are intended to be used both in clinical settings at the point of care and also support data exchange. Value sets will represent various care settings, so be applicable for primary health care, acute care, and eventually other sectors as well. We're aiming to leverage existing established standards within the Canadian and international sources where possible and reference existing Pan-Canadian value sets. By promoting best practices for terminology, we're aiming to maximize opportunities for reuse of data and minimize administrative and maintenance burden. When considering existing value sets identified in guiding standards, we established evaluation criteria to assess the options. To promote interoperability, pan-Canadian and international terminologies are preferred, especially where there's wide adoption. We are not looking to recreate the wheel. We are also aiming to select terminology options that have minimal barriers to use, especially in terms of financial constraints or complexity of use. It's also important that the terminology is inclusive and reflects Canada's diverse population and aligns with principles of equity and other factors that influence health status, which are often referred to as the social determinants of health in North America. Our initial focus has been on primary health care, but with the Pan-Canadian Health Data Content Framework intending to connect a person's health records across care settings, the terminology also needs to be broadly relevant across care settings, with a person-centered approach in mind throughout.
Thank you. So back to me. So the next section is on the use case. So we'll be talking about the immunization, which has been a journey that we've started many years ago, 2012 to 2013, and is also incorporated into the framework that Jacqueline has talked about. So the initial request for immunization content to be developed using a standardized terminology was initially initiated by one jurisdiction, the Ontario province in Canada, to support a common set of content that was going to be shared among the network, the public health surveillance network, as well as with the federal organization, which is Public Health Agency of Canada. So at the time, we have developed SNOMED CT explicit concepts and terms that were supporting the immunization use case and requirements for the different jurisdictions that were at the time adopting SNOMED CT. The use case, the main initial use case, which are still the reference at this moment, are to support administration of vaccine, historical capture for different types of vaccine when we don't have the explicit information on the vaccine trade name, for example, product that was administered to a patient, forecasting management, inventory management, as well as analytics. So as said, we have developed the content a long time ago. So publication of that content happened in 2013. So at the time, we have added new enhanced concepts and terms in our Canadian edition. And this is an ongoing effort. So we still manage that at this moment. And we are even more responsive since the COVID pandemic happened. Struck out. So Canadian edition does reconcile the most recent international monthly release of SNOMED CT as well as Canadian edition. So we leverage at the end of publication month the SNOMED international version of that same month. So we publish now 4 times a year on a quarterly basis. So 2024 was the first starting point of that higher frequency of publication. So we publish now February, May, August, and November. Infoway is currently working on enhancing the offer to not only the public health surveillance community, but also all Canadian through the Enhanced Canadian Standards Release Center, which is also known as the NRC, or was the older name for the for that NRC unit, I would say, at Infoway. So SNOMED CT standards offers clinical coverage and comprehensive coverage that is now being leveraged by the immunization registry owners in each Canadian jurisdictions. SNOMED CT standards offers consistency and comparability of data. It does minimize ambiguity. It does improve reporting of immunization within the Canadian registries as well as through the information system. SNOMED CT standard is now seamlessly integrated in system and does support data exchange between jurisdictions and the Public Health Agency of Canada. And in this year, earlier this year, April, we have officially launched the National Vaccine Catalog. I say we, but it's not Infoway that has launched it, but we collaborated really closely to that initiative that is under the Public Health Agency of Canada's umbrella. That national vaccine catalog was implemented, leveraging all of the Infoway subset content that we have developed since 2013, and we still are collaborating to enhance the content and processes going forward. So we have currently, on this slide, you do have the different stakeholders that we work with, so different groups of stakeholders, I should say, and therefore there's a lot. So we basically have a direct line of communication with the public health surveillance community that is hosted on our InfoCentral platform, where we collaborate, we have monthly meetings, and we share information, updates, and we also use that platform to respond to any inquiries or requirements from the group as well. So Infoway does have a full-time employee or SME that is looking at all immunization content. So that person manages the immunization request, confirms the scope. Is it Canadian specific scope or international scope? And therefore, if there is any need to submit any content that needs to be created at the SNOMED International through the CRS system, we do so as well. We also update on a quarterly basis the immunization subset based on to the requests we receive, and we engage with the different actors in the network, really active community, as I said earlier. And we also have kind of augmented our collaboration and our visibility, I would say, in the different groups that we that were and are currently networking at in the Canadian space, but we're getting closer to the users and the owners of these registries. So we are, in fact, responding quicker, faster to the multiple requests we receive. From the challenge and lessons learned, so you do have a couple of those on the slides. Basically, because we have augmented the lenses or the reach out and the awareness of the different groups of people that are that need the immunization content and want to leverage the immunization content Infoway has developed. Sometimes it is challenging to ensure that we have a consolidated view and consolidated requirements. So you know, sometimes it does require more than discussions. So it's meeting and time that we need to spend together in order to clarify requirements and be able to support one kind of set of requirements for the whole Canadian space. With the integration or the publication of the new National Vaccine Catalog, they have we've been having a really good collaboration with these guys, and they have integrated their system in more or less really closely to our systems, from the tracking tool we use in forms for the request for change, and the different perspective that this is allowing. For example, the release notes, anything that's going to be released in one Canadian edition publication is also available for them. And whenever we receive requests for change, they are challenging us whenever there's some missing parts, or there's where, you know, we've only partially modeled some of the content that is part of the whole immunization model. They then ask us on a regular basis, have you finished? Are we missing something? So we are getting really good collaboration there. And again, collaboration, integration is key for us for any of the work that we do with our Canadian stakeholders. What else do I need to say here? I think there was one last thing. Yeah, so SNOMED CT is more and more recognized. So not only do we have that recognition at the public health surveillance groups, and those engage additional engaged groups that you saw onto the previous slide, but it's also part of our specification. So we have, as Jacqueline has mentioned earlier, we have the framework where we absolutely leverage all immunization content and value set, but we also have other specifications that have been developed in Canada that are also leveraging all of these this work. So I'm talking here about the Canadian Patient Summary, which we call PSCA, as well as the framework, as I mentioned. So the benefit of using SNOMED CT are of multiple folds, of course. So using a recognized global standard as such as SNOMED CT does and customize it to meet our specific requirements, augment the quality and timely information. It does optimize the access, efficiency, quality, and the outcome through all the continuum of care for the benefit of not only the clinicians, but the patients and the families as well. So we are working towards at Infoway to increase our offer for the community of practice and the standards communities overall. So we're kind of, we want to augment our service offerings and the products offerings. So from the old known NRC to the future to be known, to be better known Canadian Standards Release Center. To better support Canadian stakeholders on standards awareness, adoption, implementation, and again, engage closer to the standards community, not only from the immunization perspective, but also from the vendors, for example, perspective, developing more guidance documents and offer other support as required for the community. So the next slides you're going to have here are a snapshot of a couple of specifications. So this one here is what Jacqueline has presented. So the Pan-Canadian Health Data Content Framework, where you do have the data elements. So again, it's a snapshot. The immunization piece here is longer than that in a framework, but it does give you the elements, data elements, the specification also of the value sets, and some additional information here. The next one is the logical data model, where you do have, thank you, where you do have the representation, as again explained by Jacqueline, as part of the deliverable of the framework. And this is a snapshot of the patient summary for Canadian specification, PSCA, where you do see, again, a snapshot of where immunization content fits into. We have included into the presentation a couple of references, and also we use a lot of abbreviations, so abbreviation list there to help you out. Thank you.
Wonderful, thank you. Thank you, Linda. We've just got a couple of minutes for questions. I believe Jacqueline's joining us from Canada online as well. Can I take questions from the room?
Thank you. My question is, where is the National Immunization Registry? I mean, who hosts this? The second one is that you said in June 2024, there is the bill, right? And it's stick that healthcare provider don't provide the immunization data. I mean, the law, how the law help implementation between the territory that you have filed, something like that. So two questions. Thank you.
Thank you. Thank you for the questions. The first question, can you remind me? Oh yeah, the registry. So the registry are jurisdictional. So we do have multiple jurisdictions in Canada, and each jurisdiction has its own registry. And the National Vaccine Catalog supports is the federated, I guess, organization, and where all of the jurisdictions are either getting information from or providing requirements to. So either way, it can work. So that's, I think, I think I've answered your first question.
Unfortunately, we've run out of time.
Oh,
please feel
So we
free
can
to speak to
directly.
Linda after the session. She's here, of course. Thank you so much for your session.
Thank you, Jacqueline, for being
Sorry
here.
to cut you short. Thank you.